Well, Jessica, along with that patient who had a broken leg that had to be amputated, doctors at hospitals across the state say they are seeing just too many patients who are waiting too long to seek medical help. Here at Providence St. Peter in Olympia, we asked them to look back and compare some numbers from last year to this year. And if you look at the traffic for the two marches, they saw a 17% decline this year. And this April, a 33% drop, 1/3 of the number of patients who came in compared to April 2019. And those are the kinds of numbers being seen across the state. Doctors at Grays Harbor Community Hospital say they're hearing from patients who are afraid if they go to the doctor or the hospital, they'll get COVID-19. So they're hoping whatever health problems they have will just go away. But in some cases, those problems got worse. Strokes, heart conditions, and that case of a patient who fractured their leg and did not immediately get medical help.
I don't know if they thought that it would get better on its own, or maybe they didn't think it was broken, denial. You're hoping that it's not broken. By the time that person presented, unfortunately, there was enough damage with circulation, infection, that person lost their limb.
Dr. Wong says while coronavirus has changed so much, one constant, if you think you need to see a doctor, see a doctor. Call your doctor. Call your doctor's office if you have any problems that you think are serious. If you catch them early, we all know your odds of recovering are much better. Especially if you live in a rural area. Some of those small areas can't handle more extreme or emergencies, and you have to get an air ambulance involved. So if you call your doctor, you're going to be in much better shape. Back to you, Jessica.